over. So my name is Angelica Sagath. I'm going to be your host today. And I'm going to start off by telling you a little bit about who I am. Then we're going to go into what is osteopathy or osteopathic manual therapy, to be specific. And then we're going to talk about osteopathy for prevention, osteopathy for palliative work, and osteopathy for curative work. And then we're going to talk about what each of those terms mean or words mean. And then we're going to also talk about the important concepts and principles in osteopathy as we talk about the definitions of those words. Okay, so let us get started. So again, I'm Angelica Sagath. I'm an osteopathic manual therapist. I'm also a Reiki practitioner, level 3, and I used to be a regulated kinesiologist and do Pilates, a Pilates instructor. So currently I am working at the Osteopathy and Healing Center. It's my own office. I've worked at various different locations since 2011 when I graduated. And if you want to find out more about who I am, you can go to our Osteopathy and Healing Center.com website, and you will find there more information about who I am, also more information about what osteopathy is. So let's get into, well, what is osteopathy? So when we talk about osteopathy, we're talking about treating the whole body. So one of the principles in osteopathy is that the whole body is a dynamic unit of function. Therefore, when you go to see an osteopath, they're not just going to look at one area of the body that you may be having certain symptoms, like let's say pain or discomfort. They're not just going to look at pain or discomfort, let's say, for example, in your hip. They're going to have to address the whole body, meaning they're going to have to check what the sacrum is doing, what the spine above is doing, what the feet below is doing. So I got a skeleton here just so you understand. You can visualize, if you're visual, what I'm talking about. So let's say you go to see an osteopath and you have a problem with your hip. Well, one of the principles in osteopathy is that the body is a dynamic unit of function. So I'm not just going to look at your hip. I'm also going to check what the sacrum in between the hips is doing, and I'm going to check what the spine is doing, what the feet below are doing. So an osteopath is looking for these patterns of imbalance in the body and helping to balance the body. And how do they do that? Well, osteopathic manual therapists will use different techniques. So we can use things like breathing. We can use things like oscillations, use things such as muscle energy, using muscles, resistance, and adjustments, very gentle adjustments to align the whole body. This also includes working on organs, working on the cranium. You might have heard of craniosacral work. So working on the cranium and also working on the sacrum. And osteopathy also includes working on the brain. It's called endocranial spasm release. So as you can see, osteopathy includes balancing the body using various techniques, okay? So that's a little bit about me. That's a little bit about osteopathy. And as I'm talking, you might have some questions that might pop up in your mind, so feel free to type them in, and at the end, when I am done talking, I will look at the questions and be able to answer any questions you have for me. Okay, so let's begin with the next part. And I'm going to be talking here about osteopathy being preventative, palliative, and curative. Okay, so what do I mean by preventative? Well, this is where we're treating a patient to prevent symptoms. Okay, so they're asymptomatic or they don't have any symptoms currently, but they come in for an osteopathic manual therapy session to check the body to prevent it from having symptoms in the future. So I'll give you an example. For example, treating babies. Okay, they may be asymptomatic, have no pain, no discomfort, and an osteopath is trained using their hands to be able to feel if there is anything out of balance. So an osteopath or osteopathic manual therapist will use the term osteopathic lesion or somatic dysfunction to mean that the body is imbalanced in some way. So that is what we are looking for. And another example I'll give you is long-term patients that I've seen for a long time and balance their bodies, and then they don't have any more symptoms. So now they're at the point where the treatment becomes preventative. So they'll come in on a monthly basis in order to prevent any symptoms from occurring. Okay, so that's the patient who comes in for preventative work. Now we're going to talk about palliative work. So what do I mean by palliative work? Well, this is work where the patient may come in and they're looking to feel good. Okay, so structurally they may not be sound. There may be something structurally wrong abnormally with the body. Like, for example, they might have had surgery to fuse the spine or fuse the ankles. So when we're talking about these kind of individuals that or patients that have these structural and pathological dysfunctions or lesions, it's going to take longer to treat. Okay, so this will, and as we're treating, this will be under the category classified as palliative work because we're treating the symptoms, okay? And I'll give you an example of the elderly again. If they come in and they had that spinal fusion, well, we can't fix it. It's not going to be 100%. Okay, but it's again up to the individual body, the person, and their ability to heal. Okay, so that's palliative work. And I'm going to talk here to the practitioners. If a patient comes into you and they're saying, I didn't feel better after that first treatment. What's wrong with your treatment? Okay, so this person is looking for palliative treatment. Okay, they're looking for something that will make them feel good, that will make them feel better. But remember that feeling better is not always being better. Okay? So in this case, the patient might need treatments over the course of the next couple months or the course of a year. And they may need to be spaced out as well if they had the problem that's long-term, or another word for that is chronic. They have a chronic condition. Okay? So that's about the palliative patient, and we talked about the preventative patient, and now we're going to talk about the curative approach to osteopathic manual therapy. So this is where the patient's been coming in, they've been getting their osteopathic manual therapy adjustments, and they're feeling better till they are better. So what I mean by that is they have to work harder now to hurt themselves. Okay? So they've been coming in for treatments. It might have been first starting off that they needed palliative care that went into preventative care and now became curative care. And now if they're, let's say, shoveling, well, the first time let's say they injured themselves and they were shoveling and it hurts. Let's say the hip again, if we use the same patient. Well, now let's say this winter they're shoveling, but then their hip doesn't hurt. So they have to work harder in order to hurt themselves or the area. Another point I want to make here is that the patient may feel worse before they feel better. Remember, we are rebalancing the system, the whole body. So I'll give you an analogy. You can think of the body as a collection of workers, okay? Some workers are working really, really hard, and they're just like waiting to get some time off and rest. And you have other workers who aren't working hard enough and who are slacking off. So the foreman comes in and he checks them, both of them, and he's like, okay, well, the people who were working really hard are going to rest now, and the people who were slacking off are going to do their portion or work harder now. So when we're treating imbalances within the body, or when we're treating the patients, what can happen is issues that were not there before may come up to the surface. So areas that were asymptomatic can become symptomatic, and they may feel discomfort or pain in the area. So let's stick with the same patient that came in with the problem with the hip. Okay, so they came in because of their hip hurting, and then we were doing the Osteopathic Manual Therapy adjustment, and we also worked on the sacrum, made sure that was balanced, so they had a steady base of support for the spine to sit on top of the sacrum. And we worked on the lower back, we did a foot adjustment, we worked on their feet. Okay, so their hip pain, let's say, it goes away. But now they come in and they're like, well, now I have pain in my lower back. Okay, well, that happens as we're rebalancing the system. And it's okay to feel or like re-experience symptoms in the body after adjustments. And it might be a new kind of discomfort or pain in the body. Like, let's say this patient had low back pain before, so now they start re-experiencing it. Or let's say now they start feeling shoulder pain, so that's going to be a new symptom. And that's what happens when we start rebalancing the body. Again, think of that analogy. These muscles can now rest, the ones that were holding the hip out of place. And now the ones on the opposite side have to start working and get stronger and develop, and there may be pain or discomfort associated with that as well. Okay? All right. So at this point, you may be asking, well, how many treatments would I need in order for my body to rebalance? And normally what I say to patients is give yourself at least 5 sessions to feel a change. Okay, that doesn't mean it's curative, you're cured, you have no more pain, discomfort, your symptoms are gone. That means that you felt something changed. You have to work harder to hurt yourself. You felt a change, that the pain went somewhere else in the body. Okay, you feel less pain. Okay, a change. And again, ask yourself, if you're a patient here, well, if I'm feeling the pain, if I'm feeling pain in my body, is it the same place that I felt it when I initially came for the appointment? You may realize that no, it's not. It's moved, and that's a good thing, because you take off force in the area that was hurting and we distribute it through the body, how it's supposed to function. So now let's say the person or you yourself as a patient are saying, well, I still feel the pain. And then I'm going to say to you, well, does it take more time for you to feel it? Again, do you have to work harder to re-experience and feel the pain? And if you say yes, well, that is a positive adaptation. That's a positive thing that's occurring in the body. Okay, so remember, we're not just aligning things structurally, we're also affecting the body physiologically. It's kind of like if you have an onion and you're peeling the layers off of it. Well, that's what an osteopathic manual therapist does with you, is they're peeling those layers off the onions. We take care of your hip, and then we peel another layer. We take care of the sacrum. We peel another layer. We take care of the back. And let's say we go and peel another layer, and now something emotional has come up. That is perfectly okay. For the body to be able to heal, the whole body to heal, you have to also address the emotions, the emotional state. So let's say you had a car accident, and that's when your hip started hurting. And with the car accident, you had different emotions come up. Let's say one of them was anger, that let's say somebody hit you with their car. So you're going to have to revisit, re-experience that emotion. It may come up during the treatment, it might come up after the treatment, but it also needs to be healed for the whole body to heal. So osteopathy is about the mind, the body, and the spirit, healing all of those. Okay, so don't be afraid of these reactions that might come up. It's part of the healing process. And it's your body telling you that it needs you to address it somehow, to heal it somehow. So use those symptoms you're feeling to be aware and listen to your body and help it in some way to be able to heal. And as an osteopath, well, we just, recommend patients to keep going with the process. Okay, so we talked about what is osteopathy. We also talked about osteopathy for prevention, for palliative work, and for curative work. And you could also go to our website, and again, you're going to find more information there. I'm going to show you. Okay, so if you go to Osteopathy and Healing Center.com, you can see there's the biography I was talking to you about, and you can read up about who I am, some of my experiences, why I got interested in osteopathy. Okay, there's also testimonials you can read. You can also listen to some of these testimonials. They're also on YouTube. Okay, and under osteopathy, you're going to find those principles we talked about. The body is a dynamic unit of function. The body is self-healing, self-repairing, self-regulating, self-defending. Structure, anatomy, and function or physiology are reciprocally interrelated. And 4, rational diagnosis and treatment will consider or is based on the previous 3 principles. Okay, you can see that there's various techniques that an osteopathic manual therapist can use. And we talk about the benefits of osteopathy, some frequently asked questions. Okay, so that's under the osteopathy tab. If you go under contact us, you'll find information there where we're located, our hours of operation. Okay, and you can also book an appointment online under the Contact Us tab. Okay, that's the website.